Hey guys, welcome back to Brain Trash. This is the podcast where we talk about all the things that no one else is talking about related to mental health. Today, we're going to be looking at pregnancy hormones, miscarriage, and the neurochemical shitstorm that happens once you've experienced pregnancy and postpartum. So I'm your co-host, Maria Ingalla, and
I'm Tabitha.
we are psychiatric nurse practitioners who are totally here to nerd out with you. So if you're a clinician, if you're just like wanting to learn more, you're in the right spot. We have a hormone series going on over the next couple of weeks, so continue to tune in. And let's talk a little bit about what's happening in pregnancy and postpartum. Probably the best place to start here is kind of like what's happening. Let's just like do the breakdown. What's happening with the hormones? Run me through it. Let's see. Somebody gets knocked up, then what?
Well, in the last episode, we talked about just like a typical cycle of hormones, right? And so obviously we're not having that cycle anymore because that is put on pause for our body to become a home for a crotch goblin. So what ends up happening is initially in the luteal phase, we talked about progesterone being super high. And then as that fertilized egg does not implant, progesterone falls. Well, when a fertilized egg does implant and your body's like, oh shit, here's some HCG, which is that hormone that a pregnancy test is looking for. When your body gets that signal, it does not dump out your progesterone. It actually continues to rise. So if you're a person that experiences a ton of negative mood or executive functioning symptoms in that luteal phase, congratulations, it's about to get much worse. So
it's just pregnancy too. We're not even talking about postpartum yet. Yep.
Right. And this is where, I mean, it's a pretty steady growth of progesterone throughout your pregnancy, because what that's doing is it's telling your body not to shed the lining, because if you shed the lining, you also shed that fertilized egg. And that would be part of, people who have any type of differences in terms of how that works, that can cause miscarriage, that can cause lots of bad things depending on, where you stand on the fetus that is within you. So as that progesterone rises, this is a lot of times why people feel really tired, really low motivation, that type of stuff in the first trimester, even without any mental health like diagnosis or anything like that. This is just more progesterone than your body has ever had. In this phase 2, estrogen is rising, but a lot of times, especially in the context of, focus, motivation, those types of things, the estrogen is rising. And so you would think, oh, estrogen is rising, so that's a good thing for me, because usually in that follicular phase, we talked about right in there where estrogen is high, everything is better. But we've got this overbearing amount of progesterone that's kind of inhibiting that in a way. And at the same time, we also have an increased blood volume during pregnancy that is kind of diluting everything as well. So if your meds are at the same dose that they've always been, but your blood volume is greater, they're technically at a lower serum level in your system. And so they might feel less effective in this time frame as well. To put it in perspective of like how this correlates with the postpartum period too, is all progesterone and estrogen are rising throughout. Progesterone's a little bit higher. And then as you give birth, those things tank. And so you experience this depletion of hormones that you've never experienced in your entire life. And it is brutal for anybody that's been through it. There is some type of shift for most humans, whether they have a diagnosis or not, whether they're on meds or not, in that postpartum period. And when you really look at like the numbers specifically, I look more at the estrogen, so I don't have great number data on the progesterone piece. But to put it in context, when you're not pregnant, your estrogen fluctuates somewhere between 30 and 400, right? So that's our typical non-pregnant range. In the first trimester, this typically goes somewhere 3,000 to 4,000. So you're already at like a much higher amount of estrogen than you've ever had in your life. Second trimester, 10,000. Third trimester, 15,000 or higher. So you go from maybe the low end, right, 30, or even the high end, 400, to 15,000 of estrogen, right? This end of pregnancy, third trimester, whatever, give birth. And now that is going to plummet back down to 30 to 400
Within 24 hours. So within
within 24
24
hours.
hours after giving birth, like your estrogen is driving down by 95%, which is fucking crazy. And it doesn't normalize for 2 to 3 weeks. So that's why they say like, oh yeah, the initial 2 weeks, the baby blues, that happens. That's almost universal. And it will happen to almost everyone right after birth, where you are going to be a hot mess, crying, irritable, up, down, all of the things,
Yeah.
all of it.
Yeah. And
Anxious.
also, on top of that, right? These are all horrific facts already. And you now have a brand new human who needs you for everything all the time. It's hungry, it's not sleeping, it's crying, it's a lot more noise, overstimulation. You might have people in and out of your house, or you might have a lack of people who are helping you. And so you feel alone in this endeavor of keeping an entire ass human alive, right?
Yes. And
It's
then if you are
insane.
blessed enough to be autistic and then have an autistic child, because genetics, self, I hope my kids don't listen to this in like 5 years. But anyways, one of the things that happens with this like massive hormone withdrawal is that your sensory issues are exacerbated during this time, meaning that you will feel irritated by touch. If you're breastfeeding, that's fantastic because
Mm.
those babies are all over you as they grow up and you're going to be real irritable with touch. And then you can feel like lights are too bright, sound feels more painful, you feel more nauseous, you feel more like sensitive, overwhelmed easily. So I mean, if you were ever able to like hold your shit together as like a high masking person, whether it's ADHD, anxiety, depression, OCD, autism, any of the things, it's gone to shit. Postpartum, it has gone to shit.
Yep. Yep. And there's a whole slew of other factors too that can affect all of that. But essentially, if we just look at the actual pregnant person themselves, that in and of itself is enough to dysregulate any human on a massive scale. But then you add in all of these other nuanced factors of relationships and support and are we breastfeeding and that type of shit. It just can be worse and worse. And this is something that we are actually at least giving attention to in some ways. But I think really what the attention goes towards is more of the sensationalized things like this postpartum psychosis and postpartum depression, right? These are things that in general the public has some knowledge of because there's somebody in their life that had something horrific. And just I think a lot of times when I hear this talked about just in public settings, it's more so like, oh, she had thoughts to harm her baby. What if somebody kills their baby? That kind of stuff. And yes, those are very important safety risks and things that we need to think of, but also like general functioning of a person themselves is also really, really important. And supporting the baby's well-being while also still considering what's actually going on with the parent is really, really important as well.
I remember seeing a fact somewhere, or it was like a statistic, that the best people who do postpartum depression assessments are pediatricians. That is like the people who are most like on it than anyone else. And they're like the quickest to identify it. But I remember even being in the hospital, like I just had a placental abruption. I had my preterm child, she's in like the NICU. I was like just alone in the bed the next day. And like the social worker came in and she's like, hi, I saw you have like a psych history and you were like suicidal once when you were 14. And I was like, yes. She's like, I'd like to do an assessment and make sure you're not suicidal before we give the baby back. I was like, what the fuck? Like, let's just add some salt to all of my wounds right now. And then she like had to do the Edinburgh postpartum depression scale. And I was like, it's literally 24 hours after. How is this anything? This isn't even valid right now, looking at hormones. I was just going crazy in my provider mind thinking, do you know this is like stupid? And I was trying to talk to her about it. And I think she thought I was trying to deflect. It just was not going well.
I mean, at least somebody tried to talk to you. Usually people are just handed a screener or like an iPad with a few questions at their postpartum visits or their whatever visits to just be like, oh, okay, cool. My liability is covered because she said she didn't want to kill herself.
Exactly. I mean, like, yeah, there's just so many functional problems that kind of came out. But I am happy because I think that there is a lot more knowledge around postpartum depression, postpartum OCD, postpartum anxiety. When I first got trained in this years ago, there were almost no other providers in Arizona who did this at all. And now it's like very, very common that people are just getting certified. So that's great. But there's still kind of a lack of knowledge around like the neurodivergence and postpartum and even like miscarriage and like how that affects neurotransmitters and depression and all of that too.
Yeah. There's actually and this is something that I also learned about as I was going through the perinatal training and that whole process, which I guess throw a plug out there for that for PSI, for Postpartum Support International, because
Yep.
I really don't think there's other places that do it as right as they do. And the people who were training, at least the session that I did, were very, very data heavy and very clear in their message on how neurodivergence impacts this and how much keeping a person stable throughout pregnancy and postpartum is such a huge need when it comes to especially neurodivergence, right? Because there's so many factors. But they also turned me on to the Mass Gen, just their generalized, like I get a newsletter from them. And then also I like to look through their research articles. So one of them was talking about how ADHD was found to be an independent risk factor for postpartum depression. So you hear a mom say, oh, well, I have ADHD. A lot of times even the OB will be like, oh, well, you'll have to come off of your stimulant. You'll need to stop that. But regardless of education level, socioeconomic status, any other diagnoses or risk factors for other conditions or anything, ADHD is an independent risk factor for postpartum depression. And if you think about it, it makes sense, right? If we have that huge depletion of estrogen, and estrogen is necessary for synthesizing and utilizing dopamine, it doesn't matter what you do, you're not going to have the functioning, the focus, the whatever, but you're also going to know I'm in charge of keeping a whole human alive. And that is going to be really overwhelming, really overstimulating, and likely lead to a very quick downside into that like burnout land, you know?
Yeah, dude. It's like the dopamine drops, the norepinephrine drops, and the serotonin all drops at the same time. So problematically, like people who are forced to come off of their stimulants or antidepressants, they're going to be like, oh, now my ADHD is worse and I have postpartum depression, right? And the provider's going to be like, oh, we got to take care of your mood first and ignore the ADHD component that put them in that risk factor in the first place, right? Like that's not okay. Give them their fucking stimulant back.
Well, and you're probably going to make the ADHD symptoms worse by trying to treat the mood. Yes. And people who stop their ADHD meds, it's very clear across lots of different research articles that this is going to lead to worsening outcomes, higher levels of depressive symptoms, all of that. And in one of these Mass Gen studies as well, it was talking about how when you discontinue a stimulant during pregnancy or, you know, some time in the planning phases of pregnancy or whatever, more likely to experience conflict within the family, greater difficulty having fun as a family, parenting is more difficult, more isolated from family. And so these are things that all contribute to that, hey, I'm showing up here telling you I think I have postpartum depression, but we're not identifying that, oh shit, this is maybe because you just went from, I don't know, fucking thousands of times more estrogen than you've ever had to less estrogen than you've known for months and months and months over a 24-hour period of time, and we're given a human to take care of.
Yes. And just to like throw on that, well, two things to throw on that. One, it is okay to take a stimulant during pregnancy. If you are a clinician, a prescriber, for the love of fucking God, give these people their stimulants if they don't have other risk factors that are like, you know, contraindicating it. I took stimulants during both of my pregnancy. My kids are fucking great. They're fucking great. So give them their stimulants. Anyways, the other thing, if you're breastfeeding, this also causes this hormone called prolactin, which brings out milk, right? Prolactin decreases dopamine. So once you are breastfeeding, again, your stimulant's going to be less effective and your executive functioning is going to be a shithole. So if you are ADHD and you're breastfeeding, I mean, I don't want to say you're fucked, but you're kind of fucked. You're fucked. Yes.
Well, and I think there are ways to, especially if, obviously, right, at the end of the day, the patient gets to make the decision about whether or not they want to take ADHD meds. And I will always give people education, and I will always tell them, whatever you feel is right for your family, I'm totally down for that. and I will walk you through it. And if we need to meet more often, we'll meet more often to check on you and see how you're doing and all of that, right? There is by no means a time where I'm going to be like, you must do this or else. But I will always give this information to people because I believe that they need to know this to make an informed decision, right? So if they're like, okay, I want to take a stimulant, but I'm nervous about like breastfeeding right after I take it or whatever, I will commonly switch people over to an immediate release twice a day or however many times a day so that they can kind of utilize it where maybe they wake up in the morning, breastfeed, take an immediate release stimulant, get all their shit done, all the laundry, clean up, do whatever they need to do, go to work, whatever. And then, right, you've got nap time, another feeding, and then you can decide, do I want to take the second one or am I just going to chill for the rest of the day? But this at least gives people some level of control and agency in feeling functional during one of the least functional times in a person's life.
Yes. Also, just to throw out there, totally like I breastfed on two, again, well, I guess like 1.5 children with the stimulant, and the stimulant itself was fine. It was other things that were not fine for the second one. But also that can be an option. So don't let your provider tell you that's not an option. That is absolutely a fucking option to breastfeed with that if that's something.
Well, a lot of times there's like fucking buzzwords that people use like, oh, well, we can't do that because it causes growth restriction. Like when you really look at what growth restriction means, like this could be 1 or 2 grams, right? That the amount of weight is so, if you're at a place where you're like, I cannot function and take care of my child versus they are 1 gram less heavy. What the fuck? Like it sounds really scary. Like I said, it's like buzzword, right? Like, oh, cause growth restriction. We're not doing that. I've talked to multiple OBs. I've coordinated care with them when they've told patients, hey, you should stop taking this or whatever. And then they come to me and say, well, my OB said that I have to stop it. And I'm like, okay, do we have any history or like things like that we need to watch out for? Well, no, they just said that it'll cause growth restriction. And I'm like,
literally just easy to throw out there and not have like the full research. It's even like, like, oh, it can cause cardiac effects. And it's like, if you're looking at methylphenidate during pregnancy, it does have like a small risk of cardiac effects, but it's like barely anything, dude. Like it's so rare. Like all of these effects that it's talking about, they're just so fucking rare. I'm like, but nobody's saying that. They're just kind of saying the name of it and not looking at the statistics behind it. But once you educate yourself around that, it can be very safe to take those medications during. So just going to throw that out there.
Well, and it'll be like less than 1% risk, right? And people are like, well, but that's still a risk. It's like, okay, but every single pregnancy starts off with a 3% risk. So like we're already surpassing that just by being pregnant.
Yeah. Pregnancy itself is a risk. Like having a child it's just all risks. Everything's going to be a risk for the rest of their life. And it's a nightmare to be a parent. It sucks.
And I have a lot of women who have history of preeclampsia who still take their stimulants. We monitor, we make sure that we're tracking these things. We make sure that we're having sooner appointments and that the OB's on board. There are so many things that you can do to mitigate those risks in comparison to mitigating the risk of a mother, parent, human not being able to take care of a newborn human.
Or take care of themselves when they're
Or
already
themselves, right? Or stay alive.
stay alive. Suicide's a real factor, right? That's something that we're concerned about. Postpartum psychosis, which is looking at people who develop hallucinations, delusions, most likely people who have an underlying bipolar disorder, 1 in 1,000. So, I mean, it's like 1 to 2 in 1,000, which is actually a pretty stunning number. And then to look at suicide during that rate, I think it's about suicide, infanticide, about 4% of those folks, which again, it's a huge number and that should be prevented. But these hormone shifts are fucking crazy for everybody. It's that dopamine fuck up. That's all of it. It's just everything gets destabilized for everyone.
Yeah. Yeah. One of the things that I think is most important about this specifically, because again, there's probably going to be a lot of differing information depending on if a person's psych provider is trained in any type of perinatal care, how skilled they are or how much experience they have with that, and also what their OB is telling them. And if they have any fertility specialists on board that are telling them other things. Like I've had all kinds of insane scenarios where people were told to stop something was like the only thing keeping them alive or out of harm's way and that kind of stuff. And it doesn't turn out well. So I think the biggest thing is making sure people have the resources and education that they need to make the decisions that make the most sense for them and their family, and being able to weigh that risk versus benefit. Now, obviously, if it's like a crisis situation, they aren't going to be able to have the objectivity and wherewithal to do that alone. But if you start early, right, whether that's if somebody is actually planning a pregnancy and you want to start there, I talk to all of my humans with uteruses of childbearing age about pregnancy and medications, regardless of if they plan to have a baby or not. I talk about just the basics of medications in the perinatal period and how we decide, you know, risk versus benefit analysis, that kind of stuff. And then also knowing that they have the resources they need for postpartum specifically too. And again, another pitch for PSI, Postpartum Support International has a website that has a bunch of free support groups, and they're all kind of grouped on like diagnosis or issues. There's one for non-pregnant parents, so fathers or partners or whoever, and then there's like OCD, postpartum psychosis, ADHD. They're in a bunch of different languages. They're virtual, so you can go from wherever you're at. You don't need to pack up you and your brand new potato human and go somewhere. There's so much good stuff on there in terms of the amount of resources and the specificity of resources, that knowing that your patients have these things ahead of time and know that they are supported if this happens, I think that makes all the difference in giving them the confidence to know like when it's time to reach out and seek those supports.
So postpartum.net is where you can access this. So PSI, Postpartum Support International, postpartum.net. So this has resources for both like folks who are or want to be pregnant, partners, and also for clinicians to give to their patients, to do trainings, to do all of the things. I think there's also a hotline there that they can call. So if you are doing medications and you're like, I'm not 100% on this, you can call or put in a request and they'll actually be able to get back to you and talk to you through some options and all.
There's a lot of places that do this, like U of A has one. I think MGH has one.
UMass Memorial, when I precepted there, they had one of the first ones. It was so cool.
Yeah, yeah. I think the other thing to mention too is that there is so much information on the internet. So whether you are a person just kind of listening to get information for yourself or a loved one, or you're a clinician, Googling something about the safety of meds in pregnancy is not ever going to give you, I shouldn't say not ever, but it's likely not going to give you things that are up to date, that are current research based. There used to be an old categorizing system for medications, and it'll be like, oh, this is category X, right? It's all going to be bad. The reality is there's really only, for myself at least, there's only one medication that I wouldn't.
Bro 2.
Bro 2, which one is the other one? Fuck.
What's your one? Depakote and Tegretol?
Oh, yeah. Okay. I don't ever use Tegretol anyway, so it just doesn't come into my brain. I fucking hate that med.
Yeah, I have feelings too, but you know. Sometimes.
Okay, so 2, sorry. If you use both of these 2, but Depakote, Tegretol. Because we have actual data, this is something that is, the risk is going to outweigh the benefit for sure. And there's other things that can do something similar that don't carry that same risk. But otherwise, it's all going to be a personalized risk versus benefit decision. And talking about the actual risks that we know now versus the old system of categorizing things, or somebody's Reddit rabbit hole story about how their kid came out with 3 fingers on one hand and 8 on the other because they took this specific med. Those things aren't necessarily going to give you helpful information. They're just going to continue the fear mongering. And we have enough information that as people who have had pregnancies, we know there is so much information coming at you so fast, and it's all very scary and sensationalized, that finding a provider who actually can sit down with you and go over the real risks and talk you through what that could look like in terms of the risks of not medicating your mental health during pregnancy, I think is ideal.
Agreed. I do want to touch on 2 more things before we wrap up this one. So 1 would be miscarriage, and then 2 would be kind of like, when does this normalize? So miscarriage is obviously a whole different game of grief, and it depends when things happen and what the hormone levels are. But the hormone level after pregnancy typically drops within 24 hours. After miscarriage, it can drop within just hours. So that can feel very sharp. It can feel like high anxiety. It can feel like insomnia. It can feel like you could still get the same kind of like postpartum depression. So you get depressive symptoms. You get all sorts of like awful effects after that, on top of the grief that you're experiencing, which is even worse, right? Like things that you would never want to be able to go through in your life, and how devastating that is, on top of like the hormonal effects. So that is something too that is a massive concern. For those who have a miscarriage, it takes usually about 3 to 4 months for those hormones to stabilize out and to feel like yourself again. For folks who have birthed a human, whether stillborn or not any full-term human, that would be about 24 months. So about 2 years after you give birth, you will start to feel like yourself again. Can you think about how fucking crazy that is, that 2 years? But I remember that with my first one, because around like 20 months, I started feeling like, oh my God, I feel like I'm not depressed anymore. And then again, with this one, I'm at 2.5 years now. And like, I feel normal again. Like I'm feeling like I'm not in a fog, but I felt like I was in survival mode fog, and it was just fucking hormones, you know? Like, but that's normal, and that's the reality that we have. So tell your fucking partners that they better be supportive if you've gone through that.
Yeah. Yeah. Or, you know, if you already know ahead of time, my partner is not going to be supportive, building this support network yourself ahead of time with whatever time you have, right? Obviously, if you're like, oh, I didn't know I was pregnant and I'm 35 weeks and here's this child all of a sudden, you're going to be a little bit more fucked than others. But, right, you should know somewhere in the first-ish trimester, unless there's other random factors. And so that can be kind of, hey, my goal while pregnant is figuring out what my support network looks like afterwards. And that might be PSI support groups. That might be knowing what the hotline is. That might be finding other moms in your area, other humans that have birthed humans, family, friends, whoever, and just surrounding yourself with people who at least have had the experience, so that when you're like Maria and you're freaking the fuck out and you're like, does this ever get better? You've got someone to text that will be like, I promise one day they will wipe their own ass. I promise one day it might not be quite as hard. It'll just be hard in new ways, but you won't be as fucked, you know?
Yep. I mean, on top of like having to wipe all their asses and having autistic kids with sensory issues and having them co-regulate, and then also having hormonal problems with yourself and your own exacerbated dopamine depletion and my stimulant not working. Yeah, all those things. So solidarity for you folks. Know that autism signs, traits, and ADHD traits are very commonly unmasked postpartum because of these depletions. It doesn't just magically appear, it becomes unmasked. That's normal. And
Oh yeah.
yeah,
That's something that we didn't even talk about, but like,
the unmasking.
yeah, the worst time. So historically, our data has shown, like, because we were looking at cishet white dudes, data has shown ADHD is bad in childhood, gets better in adulthood. You probably won't need meds anymore because you'll know how to handle shit. That is not the reality for most people who do not fit that role, and it actually is the worst during onset of cycling. So whether that is when your period starts or, you know, your hormones start cycling, pregnancy and childbirth, perimenopause and menopause. These are the three most significant times where girls, women, non-binary folk, humans with ovaries and uteruses start to experience these symptoms and go, what the fuck? And this is not, it's not normal to feel this way. There is some of this that is normal if you don't have neurodivergence, and it typically does not carry the level of distress in non-neurodivergent folk as it does in neurodivergent folk. And so recognizing these things isn't just, oh, I have the baby blues. Oh, I'm just going through, you know, the normal. If this is something that is severely distressing for you, behaviorally, anxiety, mood, all of these things feel so much worse, and we can link it to this huge hormonal shift. That's something worth talking about with your provider. That's something worth navigating and figuring out, how do I better support myself so that I'm not just sitting around in my brain going, I'm probably just crazy. I'm probably just gaslighting myself.
I'm lazy.
It's just
or
my
whatever.
period.
Yeah, I'm lazy. It's just, you
It's,
know,
it's that bullshit that just keeps on fueling the masking. Like, oh, well, I'm probably gaslighting myself, so I should probably just like try harder and
Yep.
pull myself up by the bootstraps, and everyone else does it, so I should be able to. And if I can, I must be a piece of shit, that kind of stuff, you know?
Find a neuroaffirming provider is advice here. And we're going to talk more in our next episode about a little bit more about like menopause, perimenopause, neurodivergence, hysterectomies, birth control, all of those things. And any of the things that can like really affect beyond perinatal and miscarriage for hormones and for mood. So thanks for tuning in, y'all. Like it, share it with folks who you know want to get pregnant or are pregnant, or your clinician, or if you think you're like, man, my provider told me to get off my stimulant, you can send them this. They'll probably get really mad listening and be like, this is the most unprofessional thing I've ever heard. But you
We'll
know
get
what?
some hate mail.
If you're that person, then fuck you. This is good information. Oh, thanks for tuning in, y'all. We'll see you next episode.